Doctor, Felipe, my head is like a light bulb and my face is like a pesky cookie.
Alright, so this video is about the postoperative period from 0 to 15 days after surgery, okay? Let's go step by step. If you want to know the postoperative period from 2 weeks to 8-9 months, please watch the other video. At the end, we will have the most frequently asked questions regarding complications and strange effects in the postoperative period that can happen in all postoperative hair transplant procedures.
So, alright, let's start with the medications then. All medications, they must be taken on the same day of surgery, after surgery. I advise generally taking it around 11:30 at night, that way the patient does not need to wake up at dawn to take the 6-0M medication, which is the analgesic. So he takes it as soon as he wakes up the next day, perfect? Regarding Rifaximin, just bring the Rifaximin the day after the surgery, don't mess with the Rifaximin. Don't pass the Rifaximin until we tell you to do it, okay? So let's go. First, guidelines, not to lift weight, not to exert physical effort, okay? That's for 14 days, okay? In order not to have an increase in pressure in the area of the implanted follicle and to avoid accidents that could cause avulsion or pulling out of the follicle, okay? 14 days. Do not perform movements of lowering your head, for example, to pick up objects on the floor or even tie your shoes, okay? That for about 5 days, more or less, okay? And don't remove the cap, don't touch the bandage, okay? This is very important. From today to tomorrow, that is, from the day of the surgery until the day after the surgery, no way, touch the bandage.
You can't touch the bandage, because if you grab a follicle on the surface of the burrow and you remove the burr, you'll pull out the follicle. We don't want to lose a follicle, okay?
Oh, I forgot all the directions. Drive.
Felipe, what am I going to do? Remember at least this guideline, which is the most important. Do not touch the implanted follicles for 14 days. 14 days without touching the implanted follicles.
Oh, drive. Felipe, how am I going to wash my head then? Very well, come on, you have to wash your head every day. Remember this. How are you going to do this head cleaning? You're going to take a spray bottle, put a little bit of neutral shampoo, I don't know, Johnson, Mustela, a small amount, a larger amount of water, make foam with this shampoo and use this foam for 14 days. While you can't touch your hand on the implanted follicles, use this shampoo foam.
How are you going to do this?
Get under the bath, let the water fall. If the shower at your house is too strong, take the shower head, wet it with the shower head. Oh, no shower. Grab a mug and play with the mug, okay? Then, if the head is wet, make the foam fall on the implanted region, covering the entire implanted region. Wait a minute and then rinse. You have to rinse thoroughly so as not to leave foam residue, okay? Donor area, you can touch it without any problem, okay? That way you will better clean the donor area. But be very careful, because the donor area is sometimes very close to the implanted region, so be very careful not to touch the implanted follicles. Beauty, finish the bath, that's where the danger is. If you forget you had the operation, grab the towel, put the towel on your head, that's a tragedy, okay? And the patients who underwent temporal reconstruction, they have to be very careful too, because sometimes they wipe their face. Bring the towel to the side, okay? Forgetting that there are implanted follicles here, then it's shit, then it's going to be bad, it's going to pull out the implanted follicles, okay? Very careful in relation to the bath, okay? Other precautions I have to take, first, to sleep. Remember that you can't lean on the follicles, okay? So how am I going to sleep? Put that travel pillow, belly up, okay? You can even turn your face a little from one side to the other, okay? As long as it doesn't touch the implanted follicle, okay? I operated on the crown. Is there a way to lie down with witches? Yes, when the surgery is on the crown, it is possible to lie on your stomach, as long as you remember that when turning your face to the other side, you cannot turn from the back, you have to turn from the front, okay? So, you can lie face down in crown surgeries, okay?
But when it is frontal surgery, it is not advised to lie on your stomach, you have to lie on your back. You can lie on the bed, put some pillows to make yourself a little higher, the travel pillow in Brazil, that's right, be careful when sleeping.
Other special precautions when getting dressed. Remember that if you are going to wear a shirt with a collar going over your head, when this shirt rubs against the implanted region, suffers some friction, it can pull out the follicle, okay? So, be very careful, avoid friction with the implanted region, preferably in the first 14 days for a button-down shirt, okay? Another care you have to take is also when putting on a cap and hat.
Cap and hat I only authorize after 14 days.
Oh, drive. Philip, but drive. So-and-so said that after the day after the surgery he can wear a cap.
You're my patient, so follow my advice, don't put your hat on there the next day, be very careful.
The gesture of putting on and taking off a cap can cause friction in the implanted follicle and the implanted follicle can be avulsed.
Remember that the implanted follicle, it is not sewn into anything, it is simply stuck in the little house. So if you have any superficial friction, you can have a follicle avulsion accident. Remember that, be very careful.
Very well. So after 10 days you will notice that those little balls, those little heads of the leaflet will be very dry, okay?
Turn everything into a cone, then you will spray sunflower oil to help humidify these cones.
Talking about Felipe, is it pharmacy sunflower oil or cooking oil?
You're not going to fry anything on your head, so it's the pharmacy oil, don't confuse it, okay?
This happens. Sometimes the patient gets confused and takes the oil from the pharmacy for cooking and it is not recommended. The recommended is Dressane, the oil from the pharmacy, okay?
Very well, twice a day you will have to spray it and on the 14th day, that is, 2 weeks, you will already be able to touch the implanted region.
So at that moment you can put on a cap, you can go out in the sun without any problem. And as for the scabs, try not to pull them off with your fingernails, okay?
Simply do superficial touches while showering.
This will help mobilize the cone for it to loosen up throughout the day. It took 18 days and the scabs still haven't come off.
You're going to take a fine-toothed comb, get under the shower, 5 minutes of warm water, falling on the implanted area, and you're going to remove the scabs with light movements from back to front. They'll come off like butter, okay? Let's go to the most frequently asked questions from patients. Usually the first day's question, Dr. Felipe, my head is like a light bulb and my face is like a pesky cookie. What is happening? Come on, what's happening is an edema, okay? It is normal to have this postoperative edema, especially when the surgery is performed on the hairline, on the frontal line. The anesthetic infiltrate migrates to the forehead and face.
So it may be swollen between the eyes, it may be swelling on the sides, so it's normal. Of course, each patient has a different reaction. There are patients who puff very little. There are patients who puff a little on the forehead. Other patients already have a slightly more significant edema. How to solve?
This edema usually resolves itself in around 4-5 days, okay? But it is also possible to do a lymphatic drainage with a professional who is trained to do this lymphatic drainage, okay? But if you want to have a little patience, it ends up giving in by itself, okay? Let's go to another question.
Doctor
Philip, what are these cracks?
It feels like there was an earthquake in my head. What is this? These paths that lead to my head in the postoperative period?
About a week, folks, mind you. There may be some kind of cracks in the shells that form between the implanted follicles.
What is that?
This is nothing more than when the transplant is performed with high density, the shells of each follicle coalesce, they come together to form a small plate. And this plate, as the postoperative edema subsides, it will crack, and may leave some paths there. So it is not a cause for concern, quite the contrary, it indicates a high density of the transplant. Let it resolve itself, then when the scabs come off, small paths may still remain. These paths are resolved after the edema of the skin resolves completely. So it's not a cause for concern.
Another question, drive. Felipe, I'm desperate because the cone is pulling out my hair. The hair is falling along with the cone.
This is natural to happen, it's not a cause for concern, okay? You see, what happens to the implanted follicle?
The implanted follicle, it comes with a bulb underneath it. It is the bulb that matters in surgery. So often when the cone comes loose, it will take the wire away. But the bulb, it's still present under the skin.
It's like a seed that's already buried there, and that seed will produce a new thread over time. So it's not a cause for concern. Remember that in the later postoperative period, all implanted hairs will fall out. So, don't worry, there's no problem with the cone falling off with the thread, okay? Okay, Dr. Felipe, how many days do I have to take Rifacin? Rifacina, 2 days only, as directed by our team. After these 2 days, the Rifacin is no longer used, which can cause allergic reactions in certain patients. Beauty? There are a number of other questions also regarding complications and some other topics that will not be covered in this video. If you want to have questions about anything else, you can leave your question in the comments here.
I'll answer it myself, okay?
And it will also be interesting to have these questions recorded there for the other patients who are using this video here for a good postoperative conduct, okay?